Welcome, I'm Luke. I work in Derbyshire County Council's Public Health, Mental Health and Suicide Prevention team. You're listening to episode 3 of the Let's Chat podcast. Today I'm joined by Scott. Welcome, Scott. Just before we begin, we'd just like to check in with our guests to see how they're doing. So out of 10, how are you feeling today?
Right now, I'm going to go in the middle 5, but you could have asked me 10 minutes ago, it'd have been a 3. And I'm sure that after this, I'll be a 7.
Scott, that's great. So, I'm about a 7 now. But, yeah, it's definitely been one of those mornings. So, Scott, just while we start, it's really great to have you on, and thank you for giving up your time for joining us. I don't suppose you want to do a bit of an introduction around why you're here, and I guess, what's brought us together?
Yeah, I'm here to talk about a charity that I got involved in and founded and set up alongside a group of other interested people just before lockdown. The charity's called Bluetonic, and it's all about getting people active in, on and around water. And it's around a concept called the Blue Mind, which is a book actually that was written by a guy called Dr. Wallace J. Nichols, who 15 or so years ago, maybe a little bit longer than that now, he realised that there was no one really gathering together why water makes us feel good. So he created a book that brings all the thinking around that together, the science and all that kind of stuff, and some stats around that. And I read that as part of my own mental health journey, really, and ended up setting a charity up.
That's great. That's brilliant. So around blue spaces and water, so what makes it so special? Like, I know personally I love it, but it'd be great to hear.
Yeah, it's just, if you think about it, we're made of water. We evolved from the water, and just being by the water is incredibly therapeutic. In this modern world, we've got to have a mind that has to do an incredible amount of multitasking. It's constantly jostling between different things. You know, if you think, 50, 60 years ago, did you have to look at as many screens as you look at now? No. Your life admin is incredibly complex nowadays. We have to have insurance for this, that, the other. We've got to monitor all sorts of dates going on. We've got to take the kids here. We've got to do this, and we've got to manage the kids' screen time on top of everything else. And the mind's craving. It's still catching up from that primal time, and it's not going to evolve to a point where it can cope with all this kind of stuff. So the need for downtime is bigger than ever, and we've got some incredible bits of water in the East Midlands that you can get by, and it can really, really help unwind you. We just use the 5 ways of Wellbeing and get people out by water, really. Yeah,
no, that's great. What sort of activities are done on water, or what do Bluetonic do to sort of enable that for people to get involved?
Yeah, we've got, like I say, we base any project that we run on the 5 ways of Wellbeing, and one project we're running at the moment is a men's mental health project, which is about prevention, really, and it's called the Under the Bridge Choir. So we get guys out, we do lots of activities based in, on and around water. We've done art and painting by the water, we've done poetry by the water, we've gone just for walks by the water and done meditation. But what we've also built into that project is that we bring the guys together and we sing under bridges. And we've done some performances that have been on local news and all that kind of stuff.
When the group started to now, how's been the progress of it, the development, I guess?
The first, we did, initially we got some lottery funding, and we did a 12-week delivery programme that we had a professor from Nottingham University to do a study on. And at the end of that 12 weeks, we ended with a performance under a bridge that the BBC came down and filmed. We had 12 men come through that project, wakeboarding, paddleboarding, and you need instructors and all that kind of stuff for that. But yeah, after those 12 weeks, since then, we've had 60 different guys come through the project up till now.
Yeah. How do people get involved with the project if they want to? Or
yeah, we've got on our social media and on our website www.bluetonic.org.uk. We've got, basically, you can just sign up there, share your details. You can approach us directly through social media. Some guys just drop a line on there, and me or my co-deliverer Ben will just happily have a conversation of an evening with somebody that's a bit like, what's this all about? Because it's quite hard to explain it. They can just come along, really. Everything that we do currently is free for people to take part in.
That's incredible. Yeah, it's really, and I guess that funding's vital then to be able to do those activities, because even, I don't know, just going canoeing and stuff like that, just, a lot involved, isn't there?
And I think historically it's acknowledged that men are a lot more difficult to engage in things around this, and what we're finding is that we've done some formal talking circles, and they do work okay once you've struck up a relationship, but some guys really struggle with that formalised chat about your mental health, and they seem to respond better while doing and stuff like that. So that's been a really good part. Learning together while you're doing things leads to natural conversations, and as well, some guys might open up a little bit about what's going on. They just need to know in their heads that other people are going through it.
Definitely. And it's about variety as well, isn't it? I think you need different things for different people, because we're all not the same. I love being out on the water or just being out walking and stuff, and like you said, just being with other people and stuff just helps, doesn't it? I think, and just having a chat about your week, or it doesn't have to be anything in particular, does it?
No.
Really helps. What have you got from it? It's been a massive project, massive thing for you to set up, and it sounds like it's grown at an incredible pace.
Yeah, well, the main thing, if you think about the 5 ways of wellbeing, one of them is giving back, and I really, really like giving back. I've had experiences happen to me. Fortunately, when I was 18, I lost my dad, and at the same time, my mother had a breakdown. So the family unit was just shattered for just really suddenly, and for a couple of years after that. I didn't deal with it at the time. It's more about if you're feeling bad one day, you can breathe into that, understand it, and know it will go away. It's like if not, you're trying to hold using water puns all the time. It's like trying to hold a ball under the water. You can hold it under for so long, and eventually it's going to pop back up again.
Yeah, no, definitely. It's the same sort of thing as like blowing in a balloon, isn't it? You're going to blow it up and it's going to pop, isn't it? Yeah. And I think as we go on, hopefully we're going to do an episode on trauma, because it's understood a lot more now. And I think a lot of people, especially in adulthood, their mental health links back to a child trauma, doesn't it? It can only be small for some people, and others like yourself, that massive trauma. And at 18, how are you meant to deal with that?
An associated trauma that your parents might have gone through. It's such a
definitely. And it's great what you're doing. Explain a bit more about the 5 ways to wellbeing and how that links to it.
And in fact, sometimes I miss one out, but I'm with an expert, so there's no way I'm going to do that.
Pressure.
So it's about the 5 ways of wellbeing are, they're driven via public health as far as I understand things, and they are about if people are getting active, if people are learning new things, if they're connecting to other people, and networking in that way, but also connecting to nature, and if they've got an opportunity to give something back. If you've got that broad range of different things going on in your life, then it helps the wheel turn quite smoothly. And like I say, we try and build those things into any project that we're doing, but we just add water and get people by the water. So other things like Swim Safe, that's all about bringing children and parents together. We run this, it's with Swim England, it's free during the summer months for people to sign up and come along, and you can find details of that via Swim Safe. If Googling it, you can find their website. They provide the booking system, and the charity gets the funding to pay a local team of swim teachers that teach that, but they do it quite innovatively, because they also talk about the Blue Mind to the families and sort of say that if you're getting these good habits through your life, it can be incredibly powerful. There's some research that shows if you just go to the water twice a week during your lifetime, you live longer. So I'm hoping I live forever. That's my goal, and I want to bring as many people with me on this journey. So
I guess from what we've discussed, just where would you recommend people to go? What are the best sort of water locations in Derbyshire, East Midlands sort of way? Are there any favourites of yours?
Yeah, you've got beautiful spots by the river and all that kind of stuff. I mean, recently we've had the flooding, so you've obviously got to be careful and and look into weather conditions, especially through the winter. But we've got lovely river walks, the stepping stones up in the peaks and stuff. We've got Carsington Water, which is a beautiful space that you can use, and they've got various water based activities going on up there. And I never knew, because I'm from the seaside originally, and part of my mental health issues that I dealt with later were the fact that when I lost my dad, I was by the sea, and the sea, although I did a lot of things that weren't good for my mental health at that time. I drank a lot more. I was out a lot. I was definitely doing that running away, trying to be happy thing. And then met my wife, moved inland, had children, and like a lot of guys, you get to a certain age and you say, why am I not right? And I've got to deal with something. So I went back and revisited things, and as part of that, like having some counselling and stuff like that, I started getting back into the water initially in a swimming pool training.
It's quite easy, just like you said, to keep running and running and running, and then eventually you just hit a wall and it can take a massive tumble, can't it? And I think if people notice it in the partners or themselves, it's just taking stock of actually, life is really hard. And I think for men, you have to live up to this perception, don't they, that you're gonna, I don't know, like look after the finances, work. You can do all of this like macho alpha stuff, and it doesn't need to be like that. You can cry, you can get upset, and you can ask for help. And I think by doing what you're doing, being able to link it with an activity and it being quite a relaxed sort of setting, is just really incredible.
It is just creating a space, really, that not that men need to talk about it, but just to have that space that is just there, and it's a safe space. And a lot of some of the guys that are coming along are just coming along because they proactively want to do stuff that's good for their mental health, or they might have had a friend that suffered from mental health and they want to raise awareness. So there's some guys doing that, and there's other guys that are recovering from cancer or battling addictions. So it's a nice mix of different people. But you wouldn't, coming along, if people come along now, they're probably going, oh, who's who? But you wouldn't know. You wouldn't know who was who.
I guess lastly, just before we wrap it up, what advice would you give to anyone maybe who's interested in getting more involved in water-based activities, or how they could get involved? Or
come along and have a look at our website. We've got walks by the water on there that we've listed. We've got activities that you can do via us, but equally use the resources that Luke's getting out there, because we're not the solution. The way I see everything is that, like, the mental health crisis that people talk about is probably created by death by 1,000 cuts. So therefore, but we always try and seek one solution. And I think that, like, by you guys showcasing all the different things that are going on, it's like fixed by 1,000 plasters. Got something that you want to deal with, just make sure you're talking and open speaking.
I think it's important. It's all right if not to be okay. And I think having a community approach, I guess if people are interested, if we'll put a link to the website in the bio. But then also there's emotional health and wellbeing website. So if water-based activities aren't someone's choice, then there's other things out there, like you said. There's art shops. There's just so much that people can access, and it's about raising the awareness, I think, so people feel comfortable going to these things, because it's scary at first, isn't it? But I think once you've taken that step, it will really help. Is there anything bit of advice you'd like to give anyone, I guess, who may be struggling at the minute? Or
just find somebody and talk. Really, just that's the first step, really. And if you don't have that person in your life, pick up the phone, speak to Samaritans or any of the free helplines that you can just talk to somebody. But the first step is just talking.
That's lovely. Thank you. That's great, Scott. Thank you for having you. This has been the Let's Chat Derbyshire podcast. Like I said, I'll put a link to Scott's website in the bio. And if you follow us on social media at DCCMHSP, we'll pop some posts on there about it. Thank you.